I'm Dr. Brian Pinsky from the Institute for Hand Surgery at the Long Island Plastic Surgical Group. And I'm here to just give you a brief public service announcement about pumpkin carving safety. Halloween is a great holiday. I love it. My kids love it. But we want to make sure that everybody has a safe and happy Halloween. And pumpkin carving is a great tradition for the family, and we just want to make sure that you do it in a very safe way. Everywhere in the emergency rooms in our office, we do see people that have injuries related to pumpkin carving. We'd like to help avoid this to make the holiday as best as possible. One really important thing about pumpkin carving is you should always carve in a very clean and well-lit area. Make sure the surface is not slippery. Make sure that the pumpkins are clean and washed properly, and that your instruments that you're going to use are also clean and in good condition. Second thing is always have adult supervision. This is not something that kids should be left to do by themselves. A lot of times we're using sharp instruments, and injuries can happen. And so this is something that's critical that we'd like to stress as much as possible. You should, if you can, it's best to leave the carving to the adults. There's a couple things you can do. You can have your kids draw on the pumpkin, draw a design, put it on the face of the pumpkin, and have you cut it. Or have an adult, supervising adult cut it. You can also have the adults possibly pre-cut the design and cut into the little design. Have the kids have fun popping out the eyes for the jack-o'-lantern or whatever it might be. And then another good point is that sharper is not always better. There's really some excellent, very inexpensive, commercially available kits that you can buy in almost any store nowadays at this time of year. The nice thing is that the instruments are blunt, so that they do not have sharp tips. So if you pass point while you're cutting, or if they get lodged inside the pumpkin, getting them out isn't going to cause, it's much less likely to cause an injury. And one final point is if there does happen to be any injury, important things are to hold pressure, clean the wound properly, and if you need any further assistance, please call 877 Dr.STITCH or go to the closest emergency room.